We're going now into session 1 of the African Youth Economic Forum. I'm so excited. I'm enjoying the interactions that we're all having currently. It's fascinating to hear what everyone is saying. Keep tweeting, keep sending in your questions, keep sharing opportunities with individuals so that at least they can know what's going on currently and on the continent when it comes to the Africa Youth Economic Forum. Right, we're going to move into the session that we've entitled Health, Well-Being, Reproductive Health Rights, and Gender-Based Violence. It's a critical discussion, and we're going to have Levi Singh, who's going to moderate that discussion for us. Levi Singh is the Youth Strategy Officer at SRHR, Africa Trust. He works with the Africa Trust as a regional youth policy advisor. He's also the former Secretary General of the African Youth and Adolescent Network on Population and Development. He now serves as a mentor to the current executive committee of the network. Levi works extensively on systems for the meaningful engagement, participation, and leadership of young people in health policy, making spaces using data to influence policy dialogue through civic diplomacy. He's also the head of Africa Health Strategy and part and parcel of universal health coverage with a focus on adolescent and youth health and well-being. Levi is also a global advisor. I mean, this guy's resume is incredible, to the Global Health 50/50 initiative, which is housed at the University College of London and seeks to realize gender equality in the global health space. Ladies and gentlemen, please welcome Levi Singh.
Thank you very much, Seth, for that warm introduction. And wow, what an inspiring forum to be joining this morning. And congratulations to the organizers for pulling us all together and for such a vibrant and thought-provoking event. I love that we started this discussion with a focus on the SDGs. And I think we need to consider a sense of greater urgency when we speak about the SDGs. So rather than talking about 2030, let's start talking about the next 116 months that we have between now, March 2021, to December 2030, and keep that at the back of our minds as we talk about the policies, the strategies, and the interventions that we would like to see governments and ourselves take to ensure universal health coverage, health and well-being, and equality for all people. So I have the great pleasure of moderating an incredible panel on health and well-being with a specific focus on reproductive health and rights and gender-based violence. I have an esteemed panel of experts, of friends, of colleagues, and of comrades who I've worked with extensively. Due to time, I won't be able to delve deep into their bios, but please be assured that their full bios are enclosed within your conference packs if you're interested in discovering more about the speakers who will be on today's panel and their social media handles and the like. So first and foremost, we have a good friend and comrade of mine, Dr. Shakira Choonara, who is an award-winning public health practitioner and independent consultant. She works with the AMREF group as a commissioner for universal health coverage and has recently been appointed to that role and has done amazing things in the last few weeks with regards to the Africa Health Agenda Conference, which is definitely worth checking out if you're interested in health and well-being more broadly. Secondly, we have Chippo Zulu, who is a phenomenal ally to young people across the continent. Chippo works as the regional advisor and the SRHR program officer at the Swedish Embassy in Lusaka. Then we have Mrs. Fatimata Moutloatse, who is the founder and chairperson of the Black Women's Caucus and a feminist social worker. Probably one of the most anticipated interventions I'm looking forward to on this panel. And last but not least, we have the incredible Diana Demba, who is the gender expert housed at the APRM and also a feminist researcher. So we have a really packed panel, an incredible group of experts with an incredible amount of expertise to share with us. I'm going to try to say as little as possible and hand it over to the panelists, but in setting the tone for this session, I think the underlying theme here is to galvanize a sense of urgency for the pro-future policy, resources, political will and energy that is needed to ensure a youthful, just, and equitable post-pandemic recovery, which has the health and well-being of the largest cohort of young people in human history at its center. This will be a frank, provocative, and action-orientated panel, which will hopefully inspire you all to take action as we attempt to reimagine and rebuild Africa from this pandemic. So without further ado, I'd like to turn over to my first panelist, Dr. Shakira Choonara. And Shakira, I think you and I have, we've been following the policy developments for the last 3 or 5 years. We've been looking at the momentum around universal health coverage and the excitement around the positioning of adolescent and youth health within that broad agenda. But we also know that prior to the onset of COVID-19 and its disastrous effects, around 200 million young women and girls had no access to modern contraceptives or family planning. We also understand that adolescent and youth health comes across the African continent. We're incredibly crippled. This is the only region in the world where AIDS, which is a preventable cause of death, is the single leading cause of our young people. So in your opinion, I want to know, what do we have to do to achieve the best possible SRHR and well-being outcomes for adolescents and young people in our continent? And what do we need to prioritize from a policy and advocacy perspective to ensure that adolescents, youth, and our SRHR aren't pushed further behind? Shakira.
Levi, it's brilliant to check in this morning or afternoon, and young people, greetings to you as well. Levi, you know, I had a bit of a laugh before I joined in on the panel about how I always give you trouble when you're a moderator. So today I'll try not to give you trouble and pick up chairs and join panels, etc. I think, you know, we kicked off this discussion talking about the future, but I think we also have to start off with an honest reflection of what we've achieved and what we haven't achieved in the past 15 years or so since the Africa Youth Charter was adopted. And so this morning I had a bit of a refresher, and I hope it simmers in all of your minds around some of the articles in the Charter that speak to health. So Article 16 speaks specifically to health within the Africa Youth Charter, but it also encompasses throughout the Charter very different sort of elements. And one of them, or the big one, is HIV. It talks about quality of healthcare services. It talks about nutrition. Interestingly, the Africa Youth Charter also includes many components on gender, reducing teenage pregnancy, gender equality, etc. And so I think it's important for us to have this refresher in mind as we look forward to the SDGs and all other commitments as well. But one thing I would point out within the Africa Youth Charter, it took place, or it was adopted in a decade, or the last decade, where HIV was quite big, and HIV continues to be big. But I think Africa is also seeing a rise in non-communicable diseases. And by this, I mean mental health. We're talking a lot about economics during this conference. So if we're speaking a lot about economics, think about young people who are unemployed, their mental health. Think about the unhealthy food environments that we have, obesity, diabetes. This is something we also need to consider, which hasn't been encompassed within the Youth Charter. It's sad to say that since 2006 until now, the issues are pretty much the same, but I guess progress has been made. To jump right into it, into policies, as much as I think global, continental, and regional commitments are important, I do think that the national level is the crux of everything. Implementation of national level policies is usually important. And unfortunately, at the moment, it's done through various political structures. Are these political structures open to all young people? Are they centered on SRHR? And the simple answer, whether people like it or not, is no. And so I think that we need to look at that as one element. The other elements we've got to look at is, it's really usually exciting to see that almost every part of the continent has an adolescent health policy. But are these policies aligned? Are these policies integrated into universal health coverage? The answer is no. And so we've got to look for policy coherence. That's the big one. Then I think it's exciting. It's always exciting to see political will. But is this political will just rhetoric? Or is it actually broken down into implementation? And two recent examples. Namibia at the International Conference on Population and Development said they want to reduce teenage pregnancy by 30%. we like this. We should put this or really push this as young people. How do we make sure we have concrete targets that we're working towards? It's not just, again, the political rhetoric. I then think, just reflecting on a few projects I've worked on and to quickly take everyone through, there's so much that we can learn from the continent, but how do we start to standardize things? So one example that stands out for me is Kenya. Kenya actually has an implementation framework for its adolescent health policy. It's integrated costing, and it's really difficult to read, but anyways, it's integrated costing, it's integrated activities, and my favorite bit is it even integrates roles and responsibilities for key stakeholders. So at a policy level, this is hugely important. The question then follows, who's actually tracking this? Are we holding governments to account? And again, the answer is no, so that's a gap. If we're looking at Zambia, I love the Zambian adolescent health strategy. Why? Because it sort of aligns to universal health coverage. It talks about the health workforce. It talks about quality. And that's an important link within UHC. What services will young people have? Looking at South Africa, the national health insurance has a glaring gap. There's no structure for young people within this. So these are some of the policy issues we need to think about. Other countries that I think, to set the tone for this meeting that really stand out, Rwanda's adolescent health policy talks about innovation. They talk about how entrepreneurs, or they've actually run initiatives such as iAccelerator, where we have entrepreneurs who come up with SRHR solutions. We then have Malawi and Uganda who have dedicated strategies on child marriages, on teenage pregnancy. But again, I caution, we don't want too many policies. We want to make sure that we're getting the issues down. Moving forward, what do we need as I sort of close off in food for thought? I started off saying that I think integration into the national health insurance, universal health coverage is critical. This is missing. While we have commitments like the Africa Youth Charter and adolescent health policies, we lack implementation monitoring and reports, really, the data. We're missing this. Finally, young people's role. Young people, unfortunately, either don't take the time to understand these different policies, or these policies are sometimes passed. And what we need to do is to be able to make sure that these policies are translated and disseminated so that we're able to actually monitor and implement this. I'm going to end up there because really this is a topic I could probably speak about forever and always.
Thank you so much, Shakira, for keeping to your 5 minutes and for pledging at the start of the panel to not give me a hassle today. I think we can have a 4-hour-long conversation just considering the amount of expertise that is on this panel. I think you raised some really incredible points, especially in your introduction when pivoting to the African Youth Charter. And we know that the African Youth Charter turns 15 this year. And I think it might be worth keeping at the back of our mind, what are the opportunities to really start provocative conversations with member states around the issues you've highlighted in terms of resourcing, in terms of accountability, in terms of data, and all the things that are really needed to give this charter teeth, because this charter is legally binding fundamentally, and it can definitely lead to greater equality, greater visibility, and greater participation of young people if it is truly taken seriously. But we'll come back to that as the conversation does move along. Secondly, I'd like to move on to the next speaker, who is Chipu. So Chipu Zulu is, again, at Swedish SIDA and at the Swedish Embassy in Lusaka. And I think it's worth at the onset commending the Swedish government for being one of a handful of countries that has really stepped up to the plate during this pandemic and hasn't cut down or revised their overseas development spend. They continue to demonstrate impressive amounts of global solidarity and to really put their money where their mouth is when it comes to funding these agendas and providing resources to organizations and institutions that do so much of this important work. I think there's also the backdrop and the reason as to why I appreciate the global solidarity displayed by the Swedes is we know that the economic shortfall on the African continent hasn't really hit us as yet. The IMF is already warning that a decade worth of developmental progress, especially in health, well-being, and social development, is currently under threat. And this is also as Africa stares down its first continental-wide recession in 35 years. So, Chipu, I'd like to turn to you and basically ask you the simplest of questions that could come to mind. In the interest of supporting and resourcing an agenda for a youthful, just, and equitable recovery post-pandemic, how do we ensure international and domestic investments in health, including SRHR for adolescents and young people?
Thank you very much, Levi. I hope everyone can hear me.
You're well and audible. Please proceed, Chipu.
Okay, that's great. So I just want to, first of all, just thank the organizers of the Africa Youth Economic Forum for reaching out to us and allowing us to participate and come and give our input to this very important event. Just like you rightfully said, what we see as being, very critical right now at this time is the need for donors like ourselves and other partners to remain committed to funding towards not only towards health, but to sexual reproductive health and rights for young people. So I can just share, just echoing what you just touched upon. As for us as Sweden, before and as well as during the COVID-19 pandemic, Sweden has remained committed to contributing 1% of their gross national income to official development assistance above the UN recommended target of 0.7%. So that in itself, Levi, already shows that there is need for partners who are really invested in the health of young people, sexual reproductive health and rights for young people, to be specific, to really try and commit to this target that has been set. For us, our government has been very clear that there is need for more global solidarity towards this core, recognizing that Africa really has a youthful population. And in order for us to harness this demographic dividend, there is importance for us to make sure that young people are healthy in order to contribute economically. So I would say, I would go on further to say, for us, sexual reproductive health and rights remains one of the main priorities for our health overseas development assistance, with about 10% going towards health. And of this, 60% supports sexual reproductive health and rights, which equates to around $330 million as of 2019. However, as much as I have said this, it's important to have these official development assistance flows in perspective to the needs of the countries, of the regions, of the continent as a whole. External financial flows, only contribute to about 22% of the financing for health in Africa. And we have seen that most funding does come from governments and people's out-of-pocket expenditure for health services. But what is worse, Levi, is according to data released by the UN Economic Commission for Africa, is that there is a financing gap of 66 billion per year in Africa for health, a gap that we see is likely to increase with additional pressure on the health system by the COVID-19 pandemic. Inequalities in access to health and health outcomes are particularly evident in Africa with the COVID-19 crisis. But this crisis, we think, also presents some opportunities for improved resilience, building back better and the urgency of efficiencies in the health system and domestic resource mobilization. So innovation by the African-driven approaches to respond to this need are key. Just really drawing on to what the previous speaker had said, and talking about domestic resource mobilization, I focus more on the international side, but we do see the need for sexual reproductive health and rights taking a very strong place in UHC discussions. So not only just focusing on just health as a whole in sustainable financing for health, but also trying to ensure that as we talk about domestic financing for health, we also make sure that as a large component is also put towards sexual reproductive health and rights for young people at a national level, as well as a continental level. I'll stop here for now.
Thank you so much, Chipu. You raise incredible food for thought in your succinct response that was also so insightful. It really stands out for me that you highlight that $66 billion financing gap. I do remember reading sometime last year that the UN had also indicated that Africa loses around $90 billion annually, or around 3.7% of its GDP continentally, to illicit financial flows, corruption, and maladministration. So it's not, in my head, it's not really where there's the shortage of resources. It's really around where we need to start galvanizing youth-led and youth-serving organizations to come to the party to hold countries accountable for the resources. This is public money. These are public funds, and this is the people's money that we need to champion accountability for, that can go on to resource these agendas and plug these seismic gaps that exist. We could have this conversation on health financing all day, and especially, again, I'd like to appreciate the efforts of the Swedish government and for yourself taking out the time to join us on this panel and to share your fantastic insights. Moving swiftly along to our next panelist, I'd like to hand over to my colleague and one of the speakers I'm most excited about to hear from on this panel, Fatimata Moutloatse, who is with the Black Women's Caucus. And Fatimata, we had a short briefing call on WhatsApp yesterday, and our conversation is still ringing in my head as I scrolled through the headlines this morning and as I continued to follow the developments coming out of the Commission on the Status of Women, which is currently undergoing. And I guess for me, the question is simply, given the phenomenal response of countries that have been led by women in confronting the pandemic, adapting to new normals, and the upcoming observation of the Gender Equality Forum, what are some of the lessons and learnings that we must draw to ensure that feminist leadership principles and movements are at the center of post-pandemic recovery strategies, plans, and policies across the continent between now and the next 116 months that we have to 2030?
Thank you so much. Thank you to the organizers for such an important and thought-provoking panel and platform. Greetings from Johannesburg, South Africa. As introduced, I am Keitumetse Fatimata Moutloatse. I'm the chair and founder of Black Women Caucus, a social movement. I'm going to go right into the deep end. I think firstly, 2021 has been quite an interesting reflection for us all globally as we see the emergence of Black women into quite powerful positions. I mean, from as far as Kamala Harris to the new Director General of the World Trade Organization, and just recently the President of Tanzania. What we are seeing is that women in power is becoming more and more topical, and probably the demand for their existence is quite greater. But I think we should not fall into the trap of just celebrating single figures, and these moments of eruption that we see happening once in a blue moon. I think the big conversation we should be having is the need for us to be mainstreaming feminist movement building and leadership into our governance structures. So as a leader and founder of a social movement that really focuses on finding multi-pronged and cross-sectoral solutions to addressing gender-based violence and femicide in South Africa, what has come out quite clear is that in a case like South Africa that has been, that has been acclaimed for its progressive constitution, we still see that there's a significant gap between its policy and its implementation. And I think the gap is really as a result of an absence of political will or clear political leadership that allows for the implementation of some of the reforms that we demand. I think it's also important for us to note that a lot of the policy structural reforms that we're looking at that have been mentioned by our panelists, and even in the opening remarks, really call for a radical, feminist, equitable approach to leadership, which women are best positioned to be driving, right? And the position and the position of women and leadership should not really just come or should not be reduced to representation, but should also speak at how do we change structures, right? So a lot of the issues that we find in South Africa and across the African continent is located in our structures, right? And is as a result of the colonial past that we come from, which is very violent in nature. So to a large extent, we've all normalized violence. We've institutionalized violence, and we can see this in how even the state apparatus, such as the police, respond to Black bodies, right? So we need a concerted effort in being able to change the kind of leadership that we have currently, one that is grounded in ethics, right? One that is grounded in the need to really advance and improve the livelihoods of the most vulnerable members of society. I mean, you spoke about the Generation Equality Forums, a global process really trying to mobilize women and marginalized groups across the globe to really action against, or rather action towards gender equality. The reality of the matter is that the current state of leadership in this globally rather, right, is one that is quite bleak, and it is one that really thrives on the subjugation of marginalized groups. So what was quite interesting for me as an observation is that if you look at the global responses to the pandemic since the outbreak in 2019, in fact, we've seen that there's been a very rigid response to the impact or the effects of the COVID-19 pandemic. Countries like Sweden, are the outliners, and it's not a secret that they are seen as one of the most feminist and progressive governments globally. But what this global response has also taught us is that society is not interested in addressing the key structural inequalities that we see. So it's very difficult for me to speak against gender-based violence and femicide across the African continent without linking that up to economic productivity and who gets to participate in economic processes. And although this particular session really focuses on gender-based violence and access to sexual and reproductive health rights, I think we would be doing a great disservice if we separate the violences exerted on the bodies of women and marginalized groups away from economic processes. To date in South Africa, it cost the South African government between 14 and 22 billion rand to just respond to violence. So I think it's important that we also understand that the violence exerted on our bodies also speaks to a larger political system and institution that we are upholding. It is the same institution that is okay with the kind of civil wars that we are seeing happening across the African continent. It is the same kind of institution that doesn't allow the African continent to actively participate in terms of research around the COVID-19 vaccination and production. So, when we speak about, feminist leadership and movement building, we are in fact asking for a very radical approach to the ways in which we manage the resources of this world, right? There's so much that I want to say, but I also do want to just, bring this up as a closing remark to say that access to resources is probably the biggest stumbling blocks we have in advancing feminist realities, right? And when we speak about feminist realities, we're not speaking about realities that are just pro-women at the expense of men. We are speaking about feminist realities that are driven and are grounded by inclusivity, right? Which is something we're not seeing happening on a global, let alone continental level. It is through equitable resource redistribution that we will be able to address some of the most pressing issues that we see happening across the African continent, right? Poverty, inequality, unemployment, all of those are major stumbling blocks to the advancement of the African continent, which is quite hilarious if you ask me in retrospect, given that we've got the youngest population globally. We should be at the peak of our innovation and development.
Fatimata, could I ask you to please wrap up?
I did say that I could get carried away with this particular topic, but as I said, that it is important that we look at the ability of this continent to really be able to affect real sustainable change, even beyond the sustainable goals, right? But to also be able to undo a lot of the colonial residues that we are faced with today. So I will leave it at that. Thank you so much yet again for an amazing platform. I will drop my details in the chat box for further engagement. Thank you so much.
Thank you so much, Comrade, for those challenging and provocative remarks and for really setting the scene. I think the two things that really stand out for me is in this very week, the UN has said that at the current rates we're moving at, it's going to take at least 300 years to achieve the goal that we set out for ourselves in terms of SDG 5 for gender equality by the year 2030. That's completely unacceptable. There's no just recovery at this rate. And I think the other comment I heard on a CSW panel this last week is that feminist leadership principles and feminist movements are not necessarily the new normal. They're the new necessary. Because again, if we don't put feminist principles, if we don't put these ethics that are involved at the center of our recovery efforts, we'll continue to exclude and we'll continue to find ourselves with the same results, which are completely unacceptable at this point in time. So thank you so much, Fatimata, for a powerful intervention. I would like to go through to my last panelist, which is Diana. So Diana does really important work at the APRM and has a specific focus on gender. And I think, Diana, to inform our question to you, I think we could also reflect on what Shakira had said at the onset of the panel in terms of the importance of having accurate and adequate data and evidence as activists and advocates to make our case and to also hold member states accountable for the commitments that they've made on our behalf. So I want to know from you, from an evidence and data perspective, how does the APRM and its focus on gender create opportunities for activists and advocates to demand greater accountability at all levels for gender parity and equality? And as an activist researcher, what are some of the additions to the APRM scope of focus you would like to see to increase the pathways of political accountability for gender equality across the continent? Diana, over to you.
Thank you so much, Levi. I really appreciate the greetings to all my formal panelists. It is an honor for me to share this panel with you today, and greetings to all the participants as well. All right, thank you again for the question, Levi. So at the African Peer Review Mechanism, there's actually quite a couple of opportunities or activities that we have undertaken to make sure that we increase accountability on the continental level, but also on the national level. So just to get started, the African Peer Review Mechanism has undertaken to develop a gender toolkit. This is in response to the lack of disaggregated data on gender equality, but also looking at gender-based violence, since this is one of the key topics today. And this toolkit looks at all the policies, instruments that are available on the continent, and it also gets into the different thematic areas of governance. So we look at the democratic and political governance, economic and governance and management. We look also at corporate governance and also at social and economic development. So basically, this toolkit has been developed internally, but then with consultations of experts all across the continent. And this is really to set some kind of baseline for future targeted action in the context of COVID-19, the fourth industrial revolution, and so on. So this toolkit will basically be able to help us develop data that is addressing those key issues, gender-related issues on the continent. The other step that we have taken as APRM is that we have engaged into a gender mainstreaming strategy. And this is when Keitumetse was talking about gender mainstreaming, I was like, yes, I'm totally with you. I hear you, because it is important to make sure that for countries, member states, but then also for citizens to be accountable for carrying the gender equality agenda. We need to make sure that gender is streamlined on different spheres of society. So the guideline that we are putting together basically looks at the continental structures on the continent, governance structures on the continent, and then look at how they can practically integrate gender, looking at procurement policies, looking at communication policies, looking at gender budgeting again, and all those issues. How do we practically go about integrating them in our continental structures, but also in our national structures, right? Then also the other thing that we are really keen on at APRM is in terms of dissemination of best practices. And making sure that the experience of each is shared in terms of promoting gender equality on the continent. All right, so another opportunity that is also available in terms of like advocacy and advocacy for gender equality is through our national governing councils. So you might have heard of it before, but then one of the key structures of the APRM is the national governing councils, which are based in all 40 countries of that are member to the APRM. And they consist of, they are supposedly representing all stakeholders from the bottom up. We're looking at Africans from the grassroots, women and men. We are looking at civil society organizations, and we're even looking at the media. How do we integrate all of these different stakeholders within the governance processes to make sure that when we speak about gender equality, we all speak in unison. So when I've mentioned media just now, and this is another it's another opportunity that the APRM is exploring, because in recognition of media as the force power and the watchdogs for principles of good governance, looking at democracy, human rights, gender equality, etc. APRM is trying to basically leverage the role of the media in governance to increase accountability towards key issues like health, gender-based violence, and also use the media to be able to shape attitude towards women and gender equality, because we've found that on the continent, the narrative about gender equality can also be misunderstood. There is a perception that, oh, gender equality meaning that, okay, women now are taking over, and feminism, there's a very negative connotation when it comes to promoting women in leadership and so on. It's as if women were here to take over, but then women are here to work hand in hand with men, you know, towards a common goal, which is sustainable development. So what we did also with at APRM is that we've partnered with TAEF, the African Editors Forum, and UNESCO on developing a digital platform for the safety of journalists. And this was done also in consideration of the fact that women journalists have been actually much more victimized in the media platforms, social media or traditional media, and so on and so forth. So this is, I think I'll just stop here for now. These are just for some key initiatives that have been implemented at the APRM in order to, you know, promote more accountability in the space of governance. Thank you so much.
Thank you so much, Diana. I am enamored by your presentation, but more so that in yesterday's briefing you had referred to yourself as a feminist researcher that applies feminist principles to the important work that you undertake. And I think the most important opportunity that has come out of your intervention, I think that is useful, not just for us as a community, but also for the audience, is this emphasis that the APRM puts on internalizing best practices and sharing those best practices, and then creating knowledge streams for learning and sharing across regions and across sub-regions. And I think that we need to do so much more of that as we try to build back better. So we're rapidly running out of time, and I did say that this session was going to be provocative, it was going to be action orientated, and it was basically there to spur on some thinking and some imagination for what this post-pandemic recovery looks like between now and 2030, or the next 116 months. I think we have adequately touched on policy, resources, and the political will and energy that is needed to ensure a youthful and just and equitable post-pandemic recovery. But I want to hand it over back to my panelists, 2 minutes each. We are the tweeting generation. Sum up in your tweet, what is your key takeaway home message for the audience and for the community at large that we have, this community of progressives who is deeply invested in the development of the continent and its young people. I will pick on Shakira first. Shakira, your tweet in a nutshell.
So Levi, to start a tweet thread, no, I'm just joking. The one is that you talked about the opportunity of the Africa Youth Charter. And so I'm really worried as we end up this discussion, because yes, there's opportunity, but it's been 15 years. Why has the opportunity around healthcare not been taken? The second favorite is, I think, the model in South Africa where we had a mass mobilization around gender-based violence, which led to government sitting up, taking notice, creating a policy, and then directing resources, which isn't enough, but directing resources in the range of 1 billion rands to gender-based violence is something we need to build on within our generation.
Thank you, Shakira. On point as always. Let's pick on Fatimata.
Thank you so much. Wow, I don't even know where to start. Maybe my closing remarks is more of a challenge to say that globally, Black Africans are leading global processes that are not necessarily benefiting the African continent. Let us redirect all our energy, skill sets, and audacity towards our continent to really make this continent what it's meant to be. And also maybe tweets, actions do speak louder than tweets. So even though we're there behind our desktops and we're tweeting and we're hashtagging, let's also get into our constituencies. Let's get the policies done. Let's build these institutions. Let's build these alternative economies and alternative healthcare systems. But from me, I only promise to just be as courageous, as bold, as daring and challenging to really make Africa what I truly believe it can be. Thank you.
Thank you, Fatimata. Diana.
Thank you so much. I think the first thing I would say would be to have systematic inclusion of women and not just the 50% quotas or representation that we always refer to, because women can, women inclusion is often left as a by the way or an afterthought. The second thing I would say would be to have a wider and targeted sensitization about the policies and instruments in countries that countries have committed to, and therefore citizens should also be impacted by that. That will also impact citizens in that regard. And then lastly would be to say that greater and consistent integration of efforts amongst stakeholders, whether it's from the public sector to the private sector, we should be able to work hand in hand together. Thank you so much.
Thank you, Diana. And last but not least, I would like to hand it over to Chipo.
Thanks, Levi. For me, I would start by saying the most important thing that I want to end by saying is that we need healthy African youth who are going to be our future leaders, who are actually even our leaders, are leading in several sectors. And in order for us to do that, I just want to end with a call to action to young people to get involved with commitments that are taking place both at regional level and continental level. Within the Eastern and Southern Africa continent, a region, we know that there has been an ESSA commitment that has been ongoing up to 2020 that has contributed to improving positive health outcomes for young people. It's currently being evaluated. Young people, youth-led organizations, please get involved in that process. In Western and Central Africa region, a lot of partners are working towards developing a high-level commitment for young people in Western and Central Africa to ensure they have access to sexual reproductive health and services, and as well as comprehensive sexuality education. We know that CSC does contribute to reducing issues such as gender-based violence that we know are happening. It does help to improve health outcomes for young people. So I'd ask all young people in Western Central Africa region to get involved in that process. It's currently ongoing. And for the continent at whole, there is a continental strategy for education, for health and well-being that is currently in the conceptual phase. I will urge, all young people as well as youth-led organizations and youth-focused organizations to also get in touch with partners such as IPPF, such as UNESCO, and many others who are working with the AU Commission in order to get this strategy developed and finalized. So I would really recommend that we get involved in that process so that we can get the Africa that we want.
Thank you so much, Chipo. I think that is a perfect segue to bringing this vibrant and dynamic discussion to an end. And I love that you ended on that opportunity around this continental strategy that is there. And as we keep at the back of our minds with the duration of discussion to think around what this post-recovery agenda would look like with youth at its center, I think that continental strategy is a perfect entry point. And I know Shakira, myself, and all other interested parties on this call will definitely be in contact to make the most of that opportunity. From my side, I think my panelists have said it all. I have nothing further to add to the brilliant interventions that have been made. I think all I can reflect upon is the words of George Bernard Shaw when he once said that reasonable people adapt themselves to the world. Unreasonable people adapt the world to themselves. And therefore, all human progress relies on us being unreasonable. And I think this is the time for unreasonability. And if there's anything I heard from fellow panelists, it was this call to be unreasonable when it comes to exclusion, to violence, to discrimination, all types of inequality. So I thank you all, my panelists, for your incredible participation, for your wisdom, your expertise. I'd like to thank the audience for paying attention and for listening in. I hope this was insightful and thought-provoking for you all. Please follow the work of our incredible panelists. They're all sharing their contact details in the chat, and you'll also find their contact details highlighted in the conference pack, which was shared with you all. And lastly, a huge thank you to the African Youth Economic Forum and the organizers of this prestigious event. Looking forward to this not just being a conversation, but the start of a greater series of dialogue. So thank you so much and have a great day.
Excellent. Thank you so much, Levi. Thank you so much, Levi, for facilitating such an inspiring discussion. We didn't want it to end. The comments section was blowing up. The Twitter threads were innumerable. We couldn't count them. So thank you so much to the panelists, Levi, for really putting together such a great panel. And thank you to Dr. Shakira, great insights, to Chipo, to Ms.Keitumetse, and Ms. Diana. Guys, thank you so much. That was brilliant. I have no words to say, but thank you for really challenging our minds, bringing perspectives, but also solutions, tangible solutions that we can all participate in. So thank you so much for an amazing session. Please continue to just put your contact details on the chat, panelists. I know a lot of people already asking, how can we get in contact with you? So please do share that. And also to participants who've joined us, attendees, thank you for being with us today. Do share your contact details on the live chat so we can all collaborate and network with one another. There is a translation in English, so when you join, please be sure to choose whichever translation you'd like. There's English and French for French-speaking nations, so please feel free to do that. We're going right now into a little bit of a break, but before we run into the break, there are two opportunities that I'd like to share with you. One from the Trevor Noah Foundation, and Shalane, the Executive Director, is going to be speaking in the next session, but there is an initiative they're running called the Education Change Makers Program in partnership with YALI. Fascinating partnership, fascinating program. There's going to be a video that we're going to show just to show some education change makers in the program that they've really instituted that is literally changing the education space. And also another initiative that we're just going to let you know about for young people. It's called the African Young Innovators for Health Award, an award that is up for grabs. I believe it's $40,000. So be sure to check out that video. We will post the links to these two opportunities, the Education Changemakers in partnership with Yali and the Trevor Noah Foundation. And we'll hear more about it in session 2 of this African Youth Economic Forum. But have a look at these videos, share them with friends and colleagues. But these are opportunities as the African Youth Economic Forum that will be punting just to ensure that you are being part of the solution and participating in what's going on the African continent. So we're going to have a little bit of a short comfort stretch break. So feel free to watch the videos, grab a cup of coffee, grab some lunch, answer those emails, send that tweet, and then we'll be back in 5 minutes. So you have a 5-minute comfort break. Be sure to network, share your contact details, and check out these videos.
Nombali supports parents in assisting their children with homework after school, because every kid's first classroom is their own home.
Upon speaking to some parents, they did express that the reason why they are unable to help their children with their homework or even just with any schoolwork, with any education-related things, it's because they themselves are illiterate. That's how I came up with this project. Imfundo Aikhulelwa is aimed at equipping parents with the knowledge that they need in order for them to help their children. The success of this project is to remove that stigma, for parents to be able to help their children, for them themselves to be empowered. When they're empowered, they're able to empower their children, and therefore we get a better performance in our classrooms.
2020 has been a year like no other. Above all, the COVID-19 pandemic has proven the importance of investing in strong healthcare systems.
This is why we're excited to announce the launch of the Africa Young Innovators for Health Award, designed to highlight and support the work of pioneering young entrepreneurs in the healthcare sector. The prize will be awarded to 3 young innovators. Are you developing the next game-changing healthcare innovation? Will you be the first winner of the Africa Young Innovators for Health Award?
Vera seeks to lift African children through a low-cost educational tool called Toon Notebook.
The Toon Notebook Early Childhood Development Capacity Boosting Project, part of which is here, what we've started here, is a book that is all encompassing. Pretty much the Montessori-inspired syllabus done in a Malawian context, in an African context, because we don't want to limit this to just Malawi. It's such a huge thing that Trevor Noah has helped to take off our shoulders. I think the push that they've given us, and they've given me especially, is not just the monetary. It has been more on the psychological affirmation. They have put us on a path that will never change.
dying under the age of 5 from mostly preventable reasons, preventable causes, went from 5.8 down to 3.9.
We believe that young people have the power to change the world. We don't believe that they are passive recipients of development. We believe that young people should be active drivers of change.
Grounded in the values around social justice, and we're working to really understand and alleviate issues of inequality.
So as YouthBridge Trust, we've chosen to focus on building Africa's future, which we believe is found in its young people. Hi, my name is Seth Moody. I'm the Executive Director of the YouthBridge Trust. Our vision is to build Africa's future, and today we launched our organization to the public. Our goal is to really fund youth organizations in Africa, build the capacity of youth organizations, and through our Knowledge Hub, share thought leadership, training on the future of work. So if that's what you are about, head over to our website at www.youthbridgetrust.org to find out more and partner with us in building Africa's future.
What we do as APRM is we are an organization of the African Union. So we conduct reviews in countries.
One of the biggest challenges facing the continent is really good governance, or the absence of it. The objective is to promote good governance at the political level, economic level, corporate good governance, and socio-economic development. Those are the 4 pillars.
That's really the core business of the APRM, conducting reviews of countries and writing reports on those countries, and then working with those countries to implement the reports of their own on the state of governance in their own countries.
And it is so important for Africa to have this kind of tool, because governance is critical to socio-economic development.
We have to ask ourselves the question, to say, therefore, we need, in the first instance, a partnership among ourselves as Africans. Not only country to country, but also people to people.
Universities constantly advise policy makers. When governments in those countries articulate policy, they don't articulate policy in the vacuum. No, they articulate policy which is evidence-based. So that's what we want to encourage on our continent.
Good governance must be promoted. Good governance must not only look at processes, but also look at deliverables.
Millions of young people in Africa bear the brunt of poverty, unemployment and other social ills. This platform hopes to propel young people to become drivers of solutions.
We cannot just assume that we can train young leaders to fall into line with our established systems here on the continent and economic models.
And what we're going to do is we're going to create the Africa we want.
Where is Africa located in the 4th Industrial Revolution?
What are the policies in place that allow us to thrive in 4IR?
We are not too young to be relevant.
The youth and the women of this continent are really not just the future of the continent, but our biggest asset right from now.
And we think the best way to reflect more clearly on the Africa we want to see is to do it with young people.
So the youth are you could say, the heartbeat, the majority of our population on the continent. So we cannot really envisage this future Africa, united continent, without factoring in the role and position of our youth in it.
And I believe very strongly that if we harness the power of the youth and women, we can achieve the Africa we all want.
And so as the youth, we must have the courage to stand up and take responsibility and say, here is an issue, let us figure out a way to solve it, because it lies with us.
And I think whether in parliament, whether at the mayor level, at the council level, at the presidency level, at the minister level, young people have to be in every single key position of leadership.
And I think that the APRM provides a unique platform for civil society, business and government to talk about governance issues in ways that are sometimes not possible or not encouraged in countries. And so I think it's a wonderful tool that really can open up the conversation about how the lives of people are made better.
The African peer review system should not be treated as incidental, that you do everything else and when you've done whatever, in your spare time, you say, well, what about the African peer review? I think it has to be integral. It has to be integral to everything that we do every day.
Now, we have made tremendous progress. Now, what do we need to do? We need to do more of the good things that we have done. And we need to make sure that when these good things are done, they are done for a purpose. And what is the purpose? To make Africa a continent that will be regarded as one that is making life better for all its people.